Hello, everyone, and thank you for joining. My name is Andrew. We have today as the webinar, how payers can use AI-powered chat for self-service BI of revenue claims management. Our speaker is Steve Roberts, Healthcare Industry Advisor. Senior Healthcare Industry Advisor. Thank you, Steve, for joining us, and we're looking forward to your content. Please take it away.
Thanks so much, Andrew, and thanks everyone for joining us today and learning a little bit more about AI capabilities. Hopefully you've been following along with the series for our cascading webinars, and this is, again, one of many that we're doing. For those of you who don't know me, and if this is your first time joining, I've been in 30 plus years of healthcare, most recently at Elevance in Carillon, and then prior to that at Aetna, and then a series of technology companies. And so we're very happy to have this sponsored by DvSum today and talking about how AI can make more actionable insights in terms of your data and unleashing those the data components along with us. So hopefully you'll learn a few new things out of our discussion. Again, DvSum is sponsoring our initiative today around AI capabilities. They're based out of California, and they have a number of customers, including the Blue Cross Blue Shield family, in addition to LexisNexis, as well as a number of other big name brands across multiple different industries today. Their key mission today is to bring meaningful insights to unleash your data, and they're able to do that, and you'll learn a little bit more throughout the entire discussion today. One of the key reasons why we're having this discussion is, as you're probably in your own within the healthcare industry, you're drowning in data and you're trying to find different ways to get insights out of that data. And in some cases you have reports, but what do you do in a normal world? You typically drop out to an intranet and you pull those data components out. And so, that's basically, or you're actually going to your IT department. And so your business users are, very, very highly dependent upon those standard reports, and those analysts, in terms of creating those reports, are in short supply, and you have to work with them to make sure they understand the business context and associated with generating those reports. That cycle can take a little longer in terms of making sure that information becomes available along with it. And so with DvSum, one of the amazing things, and you've heard a lot about ChatGPT, the main difference with ChatGPT, right, in the healthcare world, and the reason it doesn't work is, one, it goes to the open internet, and then so you can't have that, right, with PII and PHI data going out there. It's just not allowed. And the second thing is you want to be able to go and do something very natural for all of us today, which is to drop out to your intranet and be able to pull out and just type naturally in natural language with the type of information that you want to be able to do. And so that's one of the exciting things that DvSum is able to do, is you're able to ask in your own natural language and being able to pull those results and have meaningful insights in real time. You're in a meeting or you're trying to drill down different data components, you can do that from your intranet browser with those core capabilities. DvSum actually offers a variety of services that comes along with it. One is data integration behind the scenes. This actually, it can look across multiple data instances. So based upon the policies that you have access to, it can look across multiple databases. If you have multiple Salesforce instances, along with Pega or Zendesk, or in the industry here, we also have Cativity and Change Healthcare, right, for revenue cycle management in terms of our topic for today. You can look across multiple instances and pull back the data to your screen, even when normally you can only look at standardized reports within that one instance. Secondly is, it's looking at the core data that goes along with it. And then most importantly, as we are reiterated, the security, this data never really leaves your network. And so you can feel comfortable with the existing policies that are in place within your organization. And so that's obviously of utmost importance. And so with that, you can be assured that it has those different modules of both the data catalog and the data quality and data governance that goes along with it as you're looking at those different data components. Some of the key challenges then that payers have today, right? We're moving from fee-based care to value-based care, and populations are going at risk for certain populations in order to get reimbursed. You have a growth in both Medicare and Medicare Advantage for chronic care members, and the government is migrating from Medicaid and migrating to Medicare Advantage in terms of those certain populations. And so you need to look across certain data sets that go along with that. You're looking at certain high risk, high cost populations and trying to provide population health services. And so with that, you're looking at that member engagement to how you're going to better manage those certain populations. You're trying to figure out how to provide a broader and more improved member experience that goes along with it, as well as improving your star ratings, right? Have you had your annual wellness visit? Have you had your flu shot? So, those key things that are going to drive the overall star ratings for higher levels of reimbursement, as well as, improving the utilization curve and figuring out how to better improve the overall pharmaceutical cost that goes along with it, especially with certain specialty drugs, and if there's more generics. All these are key examples of why you're looking at standardized reports, and in some cases looking for more in real time capabilities in terms of being able to just chat with your data that goes along with it. So today we're focused on revenue cycle management, or RCM. And so this is about how do we effectively bill and collect associated with your estimation of benefits and get reimbursed for your overall care. So as you would expect, revenue cycle management, this is typically targeted for a director of revenue cycle management or individuals who are in executive roles that are overseeing those capabilities to get real in the moment iterative insights associated with that data. So what are some examples that might be the case? We talked about it briefly, which is, again, if you're looking across disparate data sources. So if you're in Cotiviti, you're just looking at Cotiviti as an example, right? And let's say if you're migrating from one system to another, you really want to have the ability to look at from one system that may be your legacy system as well as your new system. DvSum has that capability to do that. As long as you have the policies and permissions based upon your original login. Some of the lack of standardized metrics, right? So if you're trying to come up with additional metrics in place, and so this allows you to iteratively ask questions to figure out core metrics and how to improve those. In a lot of cases, this is, healthcare is an ecosystem, right? So you're working with payers who are trying to work with providers in different settings of care. And so you're working toward figuring out how to collaboratively understand the data that's coming through so you can do the appropriate outreach and engage with those members to improve overall care for those members. And in some cases, it's about closing gaps in care and looking for shared knowledge bases and in order to move that forward. And so you're able to do that with DvSum. In addition to retrospective data components, right? So you're trying to understand the delayed data that's coming in within your system and how to make more insightful decisions based upon the data that's available at your fingertips. And at the end of the day, this is about improving the overall member experience and how to figure out how to optimize payments that should be made to them and keeping those members satisfied with what's there. So with that, just as a reminder, part of the great benefit that DvSum brings to this picture is if you don't have the standardized reports, or in some cases, let's say you have 5, 6, 7 different reports, again, DvSum looks at the natural policies that based upon your login. You can drop out to your intranet browser and you can chat just in normal English, the core capabilities for evaluating, in some cases, time-sensitive information or analytics, and naturally ask those questions in that. And it will provide that information in both a data format or in some cases a graphical format to better comprehend and understand the data over a series of time for what you have access to. So what are some of the simple key questions that you can ask? It could be associated with claims denials and finding overall trends. Readmission of members in those claims that are coming in, or and the reality is also it's the payment delays and finding trends across that core information. So, with that, DvSum Caddy is the name of the tool. It provides the core underlying capabilities and the infrastructure to, again, chat with your data in real time in an intranet browser that allows you to analyze the revenue cycle management, different scenarios and in the moment, and you can iteratively ask those questions and sort of build upon rather than looking at multiple reports. And, probably the most important thing is it's also going to help make your staff more productive and autonomous. And at the end of the day, we're here for the members to improve that. So with that, Andrew, we'll open it up to see if we have any questions, but hopefully that's covered the key topic for today around revenue cycle management for payers.
Thanks, Steve. I think I don't see questions coming in. I think in the prior sessions, you've been covering it pretty well. And thanks for putting your slide up there with your contact information, steve.roberts@dvsum.com. If questions do come in, especially if you're watching the recording. I'll remind you that we have recorded prior webinars on the other healthcare topics as well as generative AI. There you see for open enrollment, population health, and ways to employ generative AI for analytics. We have a couple more webinars coming up early next year. We invite you to register. We'll be sending out invites for those, both for pharmacies and provider in February. Thank you again for everyone's attention, and we'll see you next time. Thank you.